This patient was referred to me regarding tooth number 30. He had pain associated with this tooth number 30. According to the patient, the root canal and crown were done by his previous dentist about 1 year ago. And recently, tooth started to hurt, and he had switched dentists then. And went and saw his new dentist. His new dentist took a look and said the root canal had failed, his tooth had abscessed, and the root canal needed to be redone, and referred the patient to us for examination, evaluation, and endodontic retreatment if need be. So as you can see, crown here, previous root canal, periapical relucency here and here. All right, tooth was tender to percussion and palpation, and as you can see, there's a food pocket between number 30 and 31. I checked the contact here, and the contact was okay, but it was a little bit on the lighter side. And patient did confirm that he was getting food stuck here between number 30 and 31, and that would explain the deep pocket here. And you can see the bone destruction, bone loss there as well. But I just wanted to, I wanted to make sure that this is indeed, even though patient had symptoms, I still wanted to make sure. Okay, so I requested X-rays from the dentist who had done the root canal about a year ago. So my office just called his office, and he graciously sent us the X-rays. So I want you to take a look at his X-rays before he did the root canal, and the X-rays are from a year ago. And this is the X-ray that he sent us of tooth number 30. As you can see, there was no periapical radiolucency associated with tooth number 30 before the root canal. So the periapical radiolucencies happened after the root canal. So somehow bacteria, microorganisms got inside of the canals of this tooth and caused those periapical radiolucencies. Again, as you can see, before the root canal, there were no periapical radiolucencies. And it looks like this was a vital tooth, vital pulp. And this is his PA. Post-obturation, I think he took the PA just to make sure that his lengths were okay. And again, you can see no periapical radiolucencies. And you can also see that this very good dentist also was using a rubber dam. You can see the rubber dam clamp on this PA. Great, good job, brother. But unfortunately, still this root canal failed. Despite the fact that he used the rubber dam, this root canal still failed. That's why the success rate for endodontic treatment on a vital tooth is still not 100%. The success rate is 90%, is 90% and more, but still not 100%. And you can see why. This dentist used all precautions, used the rubber dam, and, followed all the fundamentals of endodontics, and still the root canal failed. Somehow bacteria got inside of this tooth, either during the root canal, as he was doing the root canal, even though he used the rubber dam. Maybe the rubber dam wasn't sealed enough. Maybe the rubber dam was loose perhaps a little bit. So through the margins of the rubber dam, saliva and bacteria was coming in. Maybe the bacteria got in sometime after the root canal, when he was building the tooth up and prepping the tooth for a crown. But somehow bacteria got in, despite the fact that he did his best. And you can see, again, you can see the rubber dam clamp on this PA. All right. So this is our X-ray, another angulation. We never rely on just one angulation to make a diagnosis. And you can see on this angulation, you can see there are actually two distal canals, and you can see that one of the distal canals, right there, you can see it, the outline of a fiber post. All right, right there. So you need to prepare yourself for everything, and multiple angulation PAs will give you that opportunity to diagnose all of that. So you're prepared. You know that now you have to deal with a fiber post. You need to remove it. All right. You don't want to be surprised. And again, in this angulation, you can see the periapical radiolucencies. All right. So we discussed options with the patient, and the patient wanted to try to see if this tooth could be saved. So we went ahead, went through the crown here, removed the fiber post, and these were these plastic thermofill carriers. And I have a couple of videos that are all here and also on my Instagram page and of course TikTok, Instagram, and YouTube channel. And I teach you how to remove these, my technique. All right, so but these 4 of them we removed, all right, along with a fiber post. And this is the post-op. As you can see, everything went beautifully. The apical diameter of the distal canal, the distal buccal and distal lingual joint, the apical diameter of the distal canal was over 50, so I used MTA, so I filled the entire root, distal buccal and distal lingual canals, both of them, and where they join, of course, all of this is MTA. And went ahead and temporized the tooth and referred the patient back to his dentist for the permanent restoration. We did this in 1 appointment. Of course, it fulfilled all the criteria for completing this case in 1 appointment, and that's what we did. So everything went great, as you can see. Again, this is all MTA, gutta percha and sealer. And we went ahead and temporized the tooth and referred the patient back to his dentist for the permanent restoration.